Good evening, everyone, and welcome to Pittsburgh Magazine's 2020 Excellence in Nursing virtual celebration. I'm Kelly Fry, news anchor at WTAE-TV, and I just want to begin by saying thank you tonight. Our family has been touched so deeply during the past decade or so, both here in our home and also in the hospital, by so many incredible, intelligent, caring, the list goes on, quality nurses, both in the care of our now 11-year-old son, Bennett, who was born with multiple medical conditions, and of course with my own battle with breast cancer that began in 2017. So thank you. I am so honored to therefore be part of this celebration tonight as we really get things rolling and talk about and celebrate these accomplishments of the 2020 honorees and of course the honorable mentions tonight. And I am pleased to introduce our host for this evening, Pittsburgh Magazine publisher Betsy Benson and editor Brian Heslop.
Thank you, Kelly, for your help with tonight's virtual celebration. It's long been a highlight of my year to celebrate some of the most outstanding nurses in the Pittsburgh region with our annual Excellence in Nursing Awards. This is our 4th annual awards presentation, and each year is as moving as the last. You will meet our honorees as we salute them tonight, but we encourage you also to learn more about their very different and rewarding careers by picking up a copy of Pittsburgh Magazine or reading the entire feature online at pittsburghmagazine.com. Betsy, I know this event wouldn't happen without our dedicated sponsors and judges who make it happen for us each year.
Brian, you are so right. It was 5 years ago when we gathered together the greatest minds in nursing, representing leaders from all the hospitals and nursing schools in the region, to create this special awards program. I'd like to thank the following dedicated members of our selection and nomination committee: Lynn George, Linda Homick, Jill Larkin, Paula Thomas, Linda Kometz, Jackie Dunbar-Jacob, Diane Pusetti, Mary Ellen Glasgow, Kathy Mayo, Helen Burns, Karen Allen, Nadine Englert, Paula Coe, and Dondra Jones. Thank you.
This year, the entire world has witnessed the compassion, the commitment, and the kindness that nurses bring to their jobs every day, no matter the circumstances. We've marveled at their dedication and their courage in the face of a pandemic that has altered life as we know it. Such circumstances led our panel of judges to create a new category for honorees: Pandemic Response Hero.
And now I'd like to announce the winners. Pandemic Response Hero, Kathleen Rossetti. Leadership, Claire Zangerly. Emerging Leader, Jennifer Bitz. Clinician, Charity Patterson. Advanced Practitioner, Allison Lewis. Community, Kathy Elliott. Academic, Rick Zuha. Researcher, Salah Al-Zaidi. Thank you for joining us tonight. We hope you enjoy this virtual program.
Thank you so much, Betsy and Brian, for creating this program so that we can recognize these vital nurses in our community and the role that they play, especially during these incredibly difficult times. We also want to thank our sponsors tonight because we are so thankful that they decided to play a role in all of this. First, Bridges Hospice, Star 100.7, St. Clair Hospital, Heritage Valley Health System, the Jewish Association on Aging, Carlow University, and the Duquesne University School of Nursing. Again, thank you to all of our sponsors tonight. And as Betsy and Brian just mentioned a moment ago, we do have 8 incredible honorees tonight that have just risen to the challenges that have been set before them. So let's get this started.
I'm Jackie Dunbar-Jacob, the Dean of the School of Nursing at the University of Pittsburgh. And it is with great pleasure that I introduce you to Dr. Salah Al-Zaidi, Associate Professor of Nursing, Fellow of the American Heart Association, and Certified Nurse Practitioner. Dr. Al-Zaidi is the recipient of the 2020 Nurse Researcher Award. Dr. Al-Zaidi has a strong commitment to improving care through research. Building upon several research studies, Dr. Al-Zaidi's most recent work has led to earlier and more specific identification of myocardial ischemia in the emergency pre-hospital period with life-saving implications.
Hi, my name is Paula Coe. I'm the Vice President of Nursing Education and Professional Practice for Allegheny Health Network. I've had the privilege of working with Dr. Claire Zangerly since May of 2017 when I joined the AHN team. Claire has built a wonderful nursing enterprise across the network. Her willful skill and knowledge of nursing practice and her experience as a nursing leader has really propelled AHN nursing to the forefront in southwestern PA. Claire has a vision of a global strategy, but also recognizing the local autonomy of each of our hospital campuses and nursing across AHN. She is seen as a true, authentic, and transformational nurse leader. With her years of experience, she has propelled nursing forward in significant ways.
Hello, my name is Mary Ellen Glasgow, and I am Dean of Duquesne University School of Nursing. It is a pleasure to recognize the honoree for Excellence in Nursing Academic Award, Dr. Rick Zuha. Dr. Rick Zuha is a professor and chair of the Advanced Role and PhD programs at Duquesne University School of Nursing. He is very, very deserving for the award for Excellence in Nursing Academic Award, as he is a creative, adept online teacher, teaching primarily in the PhD program, Qualitative Research in Transcultural Nursing. He has chaired many, many dissertations.
Hello, my name is Tracy Fick. I am the Vice President of Patient Care Services at Excella Health Frick and Westmoreland Hospitals. I have had the honor of working with the 2020 Pittsburgh Magazine Excellence in Nursing Clinician honoree, Charity Patterson, since she joined the Excella Health team 2 years ago. Charity is a clinical nurse on the inpatient unit at Frick Hospital. In her role, Charity has earned her professional gerontological nursing certification, demonstrating her compassion for the elderly. Charity is deserving of this award because of the way that Charity approaches nursing. Charity displays empathy and compassion in every patient interaction. She approaches each day with positivity and has a can-do attitude. Charity not only strives to make a positive difference in each patient's day, she also focuses on keeping staff morale high, recognizing that a high morale leads to a high-performing team and ultimately better patient outcomes.
Hello, I'm Dawndra Jones, Chief Nursing Officer, Vice President of Patient Care Services for UPMC East and UPMC McKeesport Hospital. It is my honor to introduce to you our Emerging Leader honoree, Ms. Jennifer Bitts. Jennifer is the Unit Director at UPMC East Step Down Unit for the past 2 years. Jennifer is truly deserving of this Excellence in Nursing Award, as when you walk on Jennifer's unit, you will always find her either engaging with one of her associates or sitting and talking with a patient. Jennifer always puts her patients and her associates first. She is truly a born leader. Over the last year, Jennifer has taken on more responsibility and now oversees the IV team as well as the step-down unit. This past year, both departments took their employee engagement survey and had 100% participation in the survey. But that's not only what they were able to achieve. They saw a 21% increase in their engagement scores under Jennifer's leadership, going from 62% to an 83% engagement.
Hello, my name is Francis Feld, and I'm a certified registered nurse anesthetist at UPMC Passavant. I've been a nurse anesthetist for over 20 years, with the last 7 years working at Passavant. Allison Lewis is the CRNA director at Passavant Hospital, where she oversees over 40 nurse anesthetists. She's held that position for just about 1 year. In that short amount of time, she has made a sizable impact on our department and also all the other hospital departments that interact with anesthesia. I nominated Allie for this award because of her exemplary service in leading our department through the pandemic crisis. Allie was new to our department when COVID arrived, and she was still learning the personalities of a large and diverse department. She led from the front, and develop policies and training procedures necessary to get our department up to speed to deliver anesthesia while wearing PPE, which was unfamiliar to most of the people in the department. She quickly identified subject matter experts within the department and utilized their skills in training others. She did all this while still running a full elective schedule. It seemed there was a new problem every day, and yet she was never overwhelmed.
I'm Dr. Betty Braxter, the Associate Dean of the Undergraduate Educational Program at the University of Pittsburgh School of Nursing. I'm a clinician, a certified nurse midwife, a researcher with a focus on health care of women across the lifespan. I am very delighted to be able to introduce Dr. Kathy Elliott, the CEO of Gwen's Girls, a nonprofit organization. And the organization mission is to improve the lives of young girls and young women. I have known Dr. Elliott for more than 10 years. She is a nurse colleague, and importantly, she is a friend, and I called her Kathy. Dr. Elliott is well deserving of the award, given her role as the CEO of Gwen's Girls. As the CEO, she has initiated 4 novel forward-thinking initiative, beginning with the Summit. The Summit was implemented in 2016. It was designed to look at gender biases in 4 different systems: child welfare, juvenile justice, health and wellness, and education. As the result of the successful summit, the Black Girl Equity Alliance was implemented by Dr. Elliott.
Hello everyone, I'm Helen Burns, Senior Vice President and Chief Nursing Officer for the Excella Health System. It's my honor and a great pleasure to introduce you to Kate Rossetti, who's being awarded the Pandemic Hero Award. Kate and I have worked together over the past decade as she has established her role as the person responsible for spearheading infection prevention and control practices here at Excella Health. Most simply, Kate demonstrates and instills confidence. That's because she's had experience. Shortly after promotion into her current position, she was confronted with the H1N1 pandemic and the necessity of engaging in a coordinated response across the care continuum. Her leadership was evident as a multidisciplinary team was organized to prepare and execute an emergency management response to the crisis. Kate needed only to re-examine these processes when faced with the Ebola crisis in 2016. She again was masterful. The confidence that the Excella Health System had in her abilities to lead an effective response from these prior public health emergencies placed her front and center in January 2020 as she convened what would be the first of many meetings in preparation for the probability of a coronavirus outbreak in the community. Kate has orchestrated the broad-based overall response, from recommendations regarding personal protective equipment to isolation tactics and healthcare worker safety. It is because of Kate's expertise, her calm, unflappable demeanor, her ability to garner consensus, and her data-driven pursuit of quality that she has recently actually been promoted to a leadership position that oversees system outcomes.
Wow, these nurses truly demonstrate compassion, kindness, commitment, and these are qualities that they bring to their job each and every day. I love hearing their stories. So what do you say? We learn a little bit more about the 2020 honorees and what really made them stand out.
Kate has been a mentor to staff in all areas. They see her as a role model with that tenacious spirit of improvement, always driving to do it better, sometimes faster. Kate holds herself accountable to high standards and inspires others to do the same. She is constantly driving efforts that position the health system as a high reliability organization. Kate's professional, logical, and reasoned approach to problem solving and team building has been a hallmark of her entire nursing career. Those very skills are now being demonstrated and recognized as she participates in a regional collaborative designed to provide support and guidance to nearly 60 skilled and personal care facilities in our region. Accepting responsibility, she is helping transitional and long-term care community leaders to problem solve in a manner that utilizes limited resources to their highest capacity. Kate turns obstacles into opportunities, reinforcing the can-do spirit amidst daunting challenges.
Charity has worked with community volunteers to create busy boxes and busy sleeves to keep confused patients distracted, to minimize them from climbing out of bed unassisted and preventing injury. Charity leads the Professional Governance Council for Excella Nursing and was instrumental in leading the team through its first ANCC Magnet System recognition a year ago. Charity also carries her work into the community. She began volunteering for the Hands of Hope Ministry in Fayette County in January 2019. Her involvement has led to participation from her co-workers to provide health-related care packages to those in need, as well as education on important healthcare topics such as infection protection, COVID-19 risks, diabetes, and allergy care. Charity views her work as more than a job, but as a career with profound meaning to provide a holistic approach to the profession.
While there were many deserving nominees in this category, what showed most in Claire's nomination and what was recognized that made her most deserving this award is her national presence and being seen as an executive nursing leader. She has served as a nursing leader and an appointed board member for the American Organization for Nursing Leadership. She is a past president of the Pennsylvania Organization of Nurse Leaders, and she is just finishing a 3-year term as a nursing representative to the American Hospital Association. With this national presence, she has done significant work related to violence in the workplace, as well as human trafficking. All of this work on national level propels her forward with the vision of nursing excellence and also having nurses work at the fullest extent of their licensure. Claire was well known by all members of the awards committee, and she was the unanimous winner in this category, which I think is a testament to how much she is seen as that true nurse executive leader in southwestern Pennsylvania and in Pittsburgh.
Because of his deep commitment to diversity, equity, and inclusion, Dr. Zuha has been committed to these efforts before most of us ever really thought about it, for years and years. He has expertise in cultural competence and transcultural nursing, writing many articles, at least over 100 publications. He's an advanced practice nurse in psychiatry, as well as a fellow in the American Academy of Nursing.
Using pioneer work in machine learning, after earning a certificate from MIT in machine learning, Dr. Alzati and his team have developed and tested an algorithm based upon novel electrocardiographic markers, which allows this early detection. The work, supported by the NIH, was recently published in Nature Communication. In addition to his outstanding contributions through research, Dr. Alzati is contributing to the development of the next generation of nursing researchers. He teaches and mentors undergraduate students and graduate students in research and serves as the chair of the honors program for nursing.
What set Jennifer apart from the rest was truly the outcomes that she was able to achieve in such a short period of time. Jennifer is truly a role model for others and have really embedded best practices into her day-to-day management style and leadership. The other thing, though, that is so remarkable about Jennifer is her willingness to always jump in and help her team No matter if it's in the middle of the night or during the day, she will jump in and take a patient assignment and work alongside of them to make sure that they are providing exceptional care on the step-down unit at UPMC East.
Dr. Elliott's nomination was a standout because of her visionary leadership at Gwen's Girls. But that's only part of the standout. She continues to practice as a psychiatric nurse practitioner at the VA Outpatient Mental Health Clinic, where she conducts psychiatric evaluations, medication management, and serves in a consultation role. She also highlighted her visionary leadership during the pandemic by galvanizing her staff to assess the needs of the parent and students and parents in her program, collaborating with the Pittsburgh Food Bank to provide more than 350 meals continuously through the early pandemic, and then moving forward, recognizing another gap, the academic gap. She worked with an academic summer mentoring program for students in her program and students for whom English is not their first language. And she provided that mentoring service. She has been recognized by the Mayor William Peduto for her role in the community. She has been among the first cohort of a Robert Woods Johnson leadership program. So she has been a true model for young girls and young women.
Over the years, I have worked with many leaders in crisis situations, including hurricanes, floods, earthquakes, and fires. Occasionally, I've been in command positions myself, and this experience allows me to effectively evaluate leaders who are followed without hesitation and those who are just managers. Allie is a leader to the nth degree, and I would rate her in the top 1% of all leaders I have known, and that includes more than one Hall of Fame football coach. Allie delegates work and authority evenly across the department and encourages staff participation in identifying and solving issues. When it became necessary to stop elective surgeries, she distributed the workload fairly across the department, and that included time off. She never hesitates to do the difficult and challenging cases herself.
Hi, I'm Michael Spacciapoli, Senior Vice President and Market Manager for Entercom Pittsburgh. We are aware now more than ever of what our nurses do for our community. We are grateful today and every day for all that you do. Congratulations to the nurses being honored this year, and we certainly thank you for your service.
So now we've heard from their colleagues who clearly hold them in the highest regard. Now it's time to hear from the 2020 honorees themselves. So we asked them, what does it mean to be selected as a 2020 Excellence in Nursing honoree? Here's what they had to say.
Hi, I'm Claire Zangerly, and I'm the Chief Nurse Executive at Allegheny Health Network. I'm extremely honored to be selected as an Excellence in Nursing Award recipient, especially in this year when 2020 was deemed the year of the nurse and midwife. And also, because of this global pandemic, the profession of nursing has been recognized as a crucial element in delivering high quality care and to the fundamental transformation of our current healthcare landscape. You know, being nominated was flattering enough, but the recognition of my contributions to nursing leadership gave me pride, not in myself, but in those that I am most privileged to lead and work for every single day.
Hello, my name is Dr. Rick Suha, and I'm a professor of nursing at Duquesne University School of Nursing. In addition, I am chair of advanced role and PhD programs. Just thinking about what this means to me, this award, I just have to say, it is such an honor. It's a surprise. It's an acknowledgement of my career. But most of all, I have to say, I'm grateful to be the recipient of this award in academic nursing. I'm so appreciative to my colleague, Dr. Melissa Kalarchian, who nominated me for this award, and for all my colleagues at Duquesne University School of Nursing, as well as all the people that have crossed paths with over the years in my career in nursing education.
Hi everyone, I'm Charity Patterson. I work at Excella Health Frick Hospital where I'm a progressive care unit nurse. What does being chosen as a 2020 Excellence in Nursing honoree in a clinical category is beyond humbling. It is a tremendous, unexpected honor. I don't take it lightly. To be recognized for doing something I care about so passionately, especially during a pandemic, is amazing. It's epic. I work beside some of the most amazing nurses who work so hard every day. I give them thanks for this honor. I give them praise for what we get accomplished every single day. It's hard, it's been a struggle, but we go in every day and we make it. And I just thank you. I thank every nurse leader who's ever helped me climb higher and reach higher, and who has recognized my ability to lead. And I am just so honored and so blessed.
Hello, Pittsburgh. My name's Jennifer Bitts, and I'm the unit director for Step Down and IV team at UPMC East in Monroeville. Being selected as an Excellence in Nursing honoree is extra special to me this year. It's been a blessing, actually. This year has been one of the most challenging in my 15 years of nursing. Over the last year, we've been asked to change the way we've done things for a long time. As a nurse leader, it has been extra important to me to really explain to the staff and communicate those changes as they came. And we're still going through change.
Hi, I'm Allie Lewis, Clinical Director of Nurse Anesthesia at UPMC Passavant and Passavant Cranberry. Being chosen as a recipient of this great honor means so much to me. I know that there are so many people out here who are so deserving of an Excellence in Nursing award, especially in light of the challenging times this year. I hope that this award, being chosen for this award, means that I have been able to make a positive impact in not only my patients' lives who are undergoing surgical procedures, but also in the lives of my colleagues, coworkers, and staff as I have moved into this leadership role as a nurse anesthetist. Thank you.
Hello, my name is Dr. Kathy Elliott, and I'm a psychiatric nurse practitioner at the VA Pittsburgh, where I see veterans in our outpatient community-based clinics via telepsychiatry. I am also the CEO of Gwen's Girls, a community-based nonprofit organization in Pittsburgh. Receiving this Excellence in Nursing Award means so much to me. To be nominated and recognized by colleagues in the nursing profession is definitely a tremendous honor, especially when we see excellence and sacrifice of nurses on a daily basis during this pandemic. There are many people, past and present, that I must share this honor with, as I could not have done this on my own. Definitely my family, co-workers, classmates who have supported me for almost 25 years. I received a great educational foundation in nursing, first at the Community College of Allegheny County, then the University of Pittsburgh, and then finally Chatham University. This has allowed me to develop into a visionary leader that uses the clinical and critical thinking skills along with compassion and advocacy skills to address the needs of the whole person. This would include understanding that person's ecosystem, our community. This is what I do at the VA in addressing the needs of those who have served our country, and at Gwen's Girls, where we provide a holistic, gender-specific approach to addressing the needs of girls ages 8 through 18, their families, and the community. This is so important, now more than ever.
Hello, I'm Kathleen Rossetti, Director of Clinical Outcomes Management for Excella Health. I oversee patient safety, infection control, and regulatory and accreditation for our system. I'm so very honored to have been named the Pandemic Planning Hero for the 2020 Pittsburgh Magazine Excellence in Nursing Awards. This experience has been life-changing. Through these trying times, I've never been so proud to be a nurse. Over 30 years ago, I picked this profession and couldn't imagine the different opportunities that I would have encountered along the way. Being a member of this amazing team that is pulled together in these trying times is very humbling. We have faced so many obstacles, we've been challenged by so many barriers, but together as a team, through our planning, through all of our efforts, we've made a difference in our patients, our employees, and our community members' lives.
My name is Salah El-Zaidi. I am an associate professor at University of Pittsburgh School of Nursing. I am honored to be celebrating this year's gala with all of you. Being selected as an Excellence in Nursing Award recipient is a tremendous honor. I am humbled to have been selected as the Researcher Honoree for 2020. The nurse researchers who have been recognized in previous years have made significant contributions to nursing science, and I am honored to be included among them. My own research focuses on real-time analytics to optimize clinical decision-making in the emergency department. The goal is to help healthcare providers identify patients with active coronary disease early during care to recognize who needs more aggressive therapy and closer follow-up. Being recognized now with the Excellence in Nursing Award is validation that my work is helping nurses to do their job better and keep patients safer.
It is truly my pleasure to have this opportunity to congratulate you all, the award-winning nurses, who this year are recognized and honored for your pandemic responses. Your individual biographies are impressive, from your frontline clinical work, your teaching of the next generation of nurses, your organization of the pandemic response, and your poignant and timely research. You embody core values of professional nursing: human dignity, integrity, autonomy, altruism, and social justice. The COVID-19 pandemic has challenged us all to consider our values as individuals and our community. Throughout my career as a pediatrician, I have worked side by side with so many nurses, and I could share many examples of nurses advocating for patients, showing compassion, kindness, and generosity, not just to patients, but also to their colleagues. Truly, nursing is a caring profession, and although I don't know you all personally, your actions as leaders speak volumes of your values and your commitment to care for others, patients, families, learners, and your community. So thank you and congratulations.
Hello, I'm Dr. Rachel Levine, Secretary of Health for the Commonwealth of Pennsylvania. I want to take the time to recognize and congratulate those who have been selected to be this year's Excellence in Nursing honorees. Congratulations to all. You, as a nurse, have risen to the challenge and have been on the front line of this pandemic since March. You have been working tirelessly to help those who are sick with COVID-19. You have demonstrated what it truly means to be an essential worker. And you all play a crucial part in making sure that Pennsylvania is a healthy, vibrant place to live. On behalf of Governor Wolf and the entire Wolf administration, I want to sincerely thank you for your work. With your help, we are one step closer to defeating this virus. Thank you again, and always remember, stay calm, stay alert, and stay safe.
Thank you, Dr. Bogan, and thank you, Dr. Levine. And if the courage and dedication of these nurses wasn't inspiration enough, they're also offering some words of wisdom for both their colleagues and aspiring nurses as well.
For anybody that considers going into the nursing profession, all I can say is there are so many doors that can take you to so many different opportunities. It's a profession like no other. And to walk away and think you can really make a difference in somebody's life, that you can have an impact, not just on them having a better day, but a better life, It's a feeling like none other. Ralph Waldo Emerson had a quote. He said, "To know even one life has breathed easier because you lived, this is to have succeeded." I think every member of our healthcare team during these trying pandemic times, we all have been able to make that one life breathe a little easier. With that, we should all be proud.
My message to those who are currently practicing nursing anywhere, you are the leaders. And the work you do is more than that. It is inspirational and life-changing. And for anybody aspiring to a career in nursing, I can say you will have chosen a life's work that will be many things that you might not get from any other career. Challenging, inspiring, trying, yet always fulfilling. And no matter where you practice in your career as a nurse, you will make a difference in human lives through direct care, education, policy, innovation, anything you choose. The possibilities are endless, and you can determine your own destiny.
I think it's very, very important for any nurse to always be true to yourself, be passionate about your work, whether that be clinical, whether it be research, whether it be nursing education, or all the variety of roles in nursing. Be passionate about it, enjoy it, embrace it. Also, always work collaboratively. And last of all, be a good citizen of the universe. It'll serve us all well.
What would I say to current and aspiring nurses? I say thank you. Thank you for who you are and what you do. I think that we're all amazing. We are working so hard together, especially through this pandemic. I'm amazed at what we've accomplished and how strong and the perseverance we've showed over the last 10 to 11 months. I think that we are making history and we are accomplishing things that we never imagined that we'd ever have to try to accomplish. What we do and how we respond, it makes a difference in the lives of the patients that we care for every single day. I would say take every opportunity given to you. Use every challenge as an opportunity to grow and climb higher, and be kind to each other and be kind mostly to yourself, because at the end of each day, just know that what you're doing is making a difference, and it's all worth it. It's all worth it if it changes one life.
One message I have for nurses and aspiring nurses is to never forget the why. Never forget why you wanted to be a nurse, why you wanted to go to nursing school, or even work in healthcare. As a child, I was sick a good bit, and I can still remember the nurses that took care of me. I can remember hearing stories about my great-grandmother, who was a nurse, walking in the snow to go take care of patients at their house. All of that impacted me, and I knew as a young child I wanted to work in healthcare. So I know there are days where I feel frustrated, I feel like I want to quit. And I just remind myself of why I wanted to be a nurse in the first place. Remembering the why is what is going to get us through these hard times.
I'd like to tell all of the current nurses and the aspiring nurses that you've chosen the best profession to become a part of. Nursing is so rewarding in so many ways, as rewarding as it is challenging, and we all know that it has been a very challenging year, and I would just like to tell all of you who are becoming a nurse and wanting to become a nurse to just stick with it and learn as much as you can, and keep working hard so that you can make a difference in patients' lives.
To current nurses, my message would be to first thank you. Thanks for all the hard work and dedication that you do to taking care of others. And I'm going to ask you to take care of yourself. We often forget about that so important self-care. To aspiring nurses, I would say nursing is the only profession that I know that you can develop transferable skills that will allow you to work in many other fields in addition to doing general nursing or clinical work. So informatics, business, research, psychiatry like me, working in a hospital, in a community, there are so many different options. So if you have a passion for helping people and you're looking into the nursing field, please, we need you. Join us. It's the best profession on earth.
This has been a year when nurses have been called upon again and again, and I am so honored that my work was chosen to be recognized as a representative of nursing. Our communities look to us and respect us, even more so during the pandemic. All nurses everywhere make tremendous contributions to the field and to our patients. I am proud and honored to work with you. In my role at University of Pittsburgh, I am helping to educate the next generation of nurses, and together we all are showing them what it means to be an educated, compassionate nurse. Nurses are stronger together, and we can accomplish tremendous things. Keep working and keep fighting.
Thank you all for your messages, and thank you for your dedication to your work. On behalf of Pittsburgh Magazine, I would like to thank you for being here, joining us tonight. And once again, congratulations to all of our honorees and honorable mentions in the 2020 Excellence in Nursing Celebration. Cheers. Have a blessed night.
I'd like to extend my congratulations to our winners this evening, as well as our honorable mentions, and also like to express my appreciation for nurses everywhere.
Bridges Hospice congratulates Kelly on her continued leadership.
You are, by definition, Kelly, a true leader and a great friend.
Thank you for all the compassion, dedication, and kindness you show our employees and patients.
Claire, I just want to give you my most heartfelt congratulations for this deserving award. I can really think of no one better deserving of this award in this year of the nurse than you. All of the work that you did bringing nurse leaders across the region together to help plan, scope, and help each other as we face this pandemic together.
Cheers to all of the award winners and honorable mentions in this Excellence in Nursing Award.
And I want to offer my deep, deep congratulations to Dr. Zuha. He is a superb faculty member. He is a great role model to our students and faculty, and it is a pleasure to congratulate him. Congratulations, Dr. Zuha.
To my fellow awardees and those who received honorable mention, I toast you.
Charity, I congratulate you on this well-deserved recognition. Thank you for your dedication, your creativity, and your enthusiasm for nursing. Congratulations. Now, cheers to all of this year's Excellence in Nursing recognition recipients.
Congratulations to all of this year's Excellence in Nursing recipients, honorable mention recipients, and all nominees. I am honored to serve our profession and our community alongside you. Thank you.
So on behalf of the entire executive team at UPMC East, we are honored and we thank Jennifer for choosing to be part of our team, and we are honored to have her working at UPMC East, leading our step-down unit. So Jennifer, I just personally say thank you. Thank you for all that you do. Thank you for choosing to be with us, and we are so excited about your award.
Cheers to the Excellence in Nursing awardees and honorable mentions. Congratulations.
Allie, you're one of a kind, and after surviving the pandemic crisis with such stellar performance, the rest of your career will be a breeze. It's a privilege and honor to work with you and to also add your name to the list of Pittsburgh Magazine's Excellence in Nursing honorees.
I would like to raise a glass to this year's Excellence in Nursing Award recipients and honorable mention recipients.
You are amazing.
Dr. Elliott, congratulations on your Nursing Excellence Award. Kathy, you are well deserving. I often use your mantra, nursing is the best profession in the world. You say that all the time, and I share that with my colleagues and my friends. And it is the best profession in the world because of nurses like you. You have committed to yourself to improving the lives of girls and young women. You enjoy it, and you make all who work with you enjoy working on that mission. So you well deserve this award. You exemplify the best in nursing, and you exemplify nursing as a caring and a science. Well-deserved award.
Here's to the 2020 Excellence in Nursing honorees and honorable mentions. Cheers and Happy New Year.
Congratulations, Kate. Thank you for the difference you make every day.
I would like to make a toast to all my fellow inductees and awardees. Cheers to you.
Congratulations to you, Dr. Elzati, for this recognition of your excellent and meaningful work.
Cheers to you. Congratulations to all. Let's look forward to a new year, free of a pandemic, but if it's here, we know we're a stronger team and we'll get through this.
Congratulations again to everyone, and thank you for joining us tonight. Cheers.